morning. It's Friday, June 19th, so it must be time for another legislative update from your North Carolina Medical Society. And folks, we're getting near the end, or at least legislators are behaving in a way that makes us feel like we're getting towards the end of session. So a lot of reopening bills have moved, regulatory bills, mini budget bills. There's been a lot of legislation passing here lately. So I am not going to cover every single bill that we're tracking, following, or even working on, because there are so many bills that have moved. So I want to point you to the blog if you are interested in learning more about everything that moved this week. But we'll start with the No Patient Left Alone bill, which I've talked about several times within the past week or two. This bill finished through the Senate process, so it will now move on to the House, and so we'll be closely following if the House decides to take this bill up and what changes they may make. The next bill I want to point out to you is one that you may not think we would originally be following, or maybe at first glance wouldn't think that it relates to healthcare, but it's a Education and Transportation Bond Bill. It's House Bill 1125. And this bill would actually allow or give Brody School of Medicine the opportunity and access to funding to build a new medical school building, which they desperately need and have been advocating for numerous bills and in numerous sessions now. But I wanted to point this out to you also because both Representative Candy Smith from Pitt County and Representative Dr. Karen Jones from Pitt County mentioned on the House floor communicating with the Brody School of Medicine students this week who were participating in White Coat Wednesday and learning about the advocacy process, thanks to our former past president, Dr. Tim Reeder, who is connecting them with the Medical Society and getting them engaged in the advocacy process. So I wanted to point that out to you as the impact that you can make in participating in this process, into educating legislators about issues. It's really seen in this piece of legislation as it moves and was discussed on the House floor. So you too can make a difference. The next bill, or two bills I want to point out to you, both relate to broadband, and one relates to the GREAT program. You may have heard us talk about this bill before. That's something that the Medical Society has been supportive of in years past. And this bill would give more funding and kind of expand the definition of broadband to different areas. So it would be for Tier 1 and Tier 2 counties to have broadband, but also in Tier 3 counties that have a need for rural service areas or in a rural census tract area. And we think this is important for you and your patients, as we've heard a lot of feedback about the importance of telemedicine and how can your patients and you have access to telemedicine services if you don't have broadband. So we think this is incredibly important to you and to your patients. And we saw another bill relating to broadband move this week as well, relating to local and state governments being able to lease some more services. So both of those bills moved this week. The next thing I want to point out to you is that Secretary Cohen was back again for the second week in a row in the House Health Committee, really to answer specific questions of legislators about coronavirus, some of the decisions that have been made by the department, and just really get into some nitty-gritty details about COVID-19 and our efforts surrounding COVID-19. And so our full summary of that presentation is located on the blog. You can see some of the slides that were presented about the uptick in the hospitalizations and cases, as well as some information about some questions that she answered. So be sure to look at the blog if that's something that you are interested in. Finally, I want to say that we are hopeful that Senate Bill 808, the Medicaid Transformation Bill, moved through the Senate process and has already been calendared for next week to be heard in the House. So we are expecting that bill to make it through the deadline, but of course that's a bill we'll be following very closely to see if that new Medicaid transformation go live date will happen of July 1, 2021. So we'll keep you updated on that. And finally, again, you can already tell from just the discussion of these bills that we've had a very busy week, and we are hopeful that the legislature will wrap up next week. And if not, certainly before July 4th is what we are hearing. Again, the end is near, or so we're hoping, in the way in which legislators are behaving and the way in which bills are currently moving through the process. So we'll be sure to keep a close eye out. Hopefully we'll be wrapping up next week. Not to worry though, we'll likely be back if the legislature does leave this early for a second round of funding. If Congress passes a new relief act, they'll likely be back probably sometime in August to pass that. That's what we're hearing at least now, but we'll be sure to keep you in the loop. Hope you have a great weekend, and we look forward to hopefully wrapping up session next week.